So what do you feel is most important in leadership?
Just in general, or
Either or both. Like,
what about in
maybe,
like healthcare leadership?
Yeah.
Well, in healthcare, I think it's important to know your employees, know what they need. You need to know the environment of healthcare. You have to keep up with the laws and all of that kind of stuff. In general, I think probably communication is the biggest deal between me and my employees. Whenever we do like employee satisfaction surveys, that's the thing that comes out loud and clear most of the time is that employees want to be communicated with. They want to know what's going on. If we make a change, they want to know why. You can't just make a change and just expect them to go along with it. They need the reasoning of why we're doing what we're doing. Mm-hmm. But, as a leader, that's what I do probably 90% of the time is I'm communicating, emailing, talking, rounding, doing those kinds of things so that my employees understand why we're doing the things that we do.
Okay. So then, like, what kind of strategies, I guess, when you're doing, like, the emails and the communication stuff, do you find work best?
So, probably in the last year, I started putting out an email once a week to my employees, and it's called a manager's update. And in that email, I talk about kind of what I've done for the week. The employees that I've or not employees, but new hires. Like if I've got a lot of positions open, they want to know, am I interviewing? Who am I interviewing? Are positions getting approved? Are people accepting? So I have like a template that I fill out every single week that has what positions I have posted, what interviews I did that week. Did I offer anybody a position that week? I do a lot of kind of kudos in that email. Like I do manager rounds on all the patients on the floor. And one of the things that I ask them is there anybody that you would like to recognize as going above and beyond? And if they give me a name, then I put that in that email. I will say, this week these people were recognized by their patients and I name them by name in that email. I also let them know if anybody's going to be out next week. For instance, next week my director's going to be out. So that's something that they want to know. They want to know if I'm not going to be here next week. So that's something that I put in that weekly email.
So, I'm guessing it's still going. Yeah. Has that, like, have you gotten feedback from them that has, like you were saying, you had the satisfaction survey things. Have they said that, like, your newsletter has improved that?
Actually, that was last year when I was doing yearly evaluations. One of the things that I asked in their yearly evaluation is there something that I can be doing differently or better to communicate with you? And that actually was an idea of one of my employees that, it'd be really nice if we knew every week, who you'd interviewed, what kind of things went on during the week, because they're not here every day like I am. I'm here Monday through Friday. They all work 3 12-hour shifts, so, they're kind of hit and miss. So they kind of like to know what's going on. For instance, this week we had a Dr. Red, which is kind of like it's not a fire drill, it was an actual event. One of our valves kind of started sparking and kind of caught on fire, not on fire, but there was a lot of smoke. But the staff, did exactly what they needed to do. They got the fire extinguisher, they sprayed it all down. So they did everything they were supposed to do. In the 15 years I've been here, we've never had anything like that happen. But if you don't address it, then the rumors go crazy. So that's one of the things I'll put in my weekly email is this week we did have a Dr. Red on the floor. The staff acted appropriately. I want to thank these people for, doing everything that you needed to do. And then that kind of squelches the rumors, if, oh my God, there was a fire on the floor.
Yeah. Yeah.
So, anyway, after I started putting out that manager update, I had a lot of people come to me and say, that is really helpful. It's really nice to know what you do all day because, they don't know what I'm doing. Like, for instance, right now, they have no idea I'm doing this, so I might put that in the email. But it just lets them know that, the things that we're working on, the things that are important to them, we're actually addressing and working on.
How many people do you actually manage?
I have about 115 direct employees that report directly to me.
And then within your employees, what type of like conflicts do you see arise that you have to deal with?
Oh, all kinds of things.
I guess like what are like the biggest ones that you have to deal with?
Well, with 120 people, there are going to be issues. Sometimes it's absentee issues. Sometimes it's somebody being late. Sometimes it's performance issues. If somebody comes to me and says, I followed this scrub tech and she left all her rooms empty or whatever, then I have to address that. My first line of strategy is I ask them to talk to that person directly if they have not already. They owe that to their peers, not to just come to me and then have me address it. They're probably going to take it a whole lot better from them because once they get to me, they feel like they're coming to the principal's office.
Right.
So most of them appreciate when somebody comes and says, hey, I noticed that you didn't document your vital signs on that patient, and so then I had to go back and try to find them and enter them for you. Most people are going to be appreciative that they came to them directly rather than coming to me and say, hey, so-and-so didn't do their vital signs, and then I've got to pull them in here and say, hey, you need to be doing your job. So that's the first line, is that I make them talk to their peers if they haven't already. And then if it escalates or if there's consistent issues with somebody, then that's something that I have to deal with.
Okay.
So in encouraging that they go to their peers themselves, is there anything that you do, I guess, like a retreat or anything like that to foster the relationships between coworkers?
Well, we do a lot of education, not just in this department, but in the hospital for, how to coach people. And we all have what we call our standards of excellence, and we all wear these on our badges. And one of the things is that you coach and compliment. And so that's an expectation of every single employee in the hospital, is that you not only deal directly with those issues, but you also compliment people. So they get this day one. When they come their very first day, they get this that says, this is what we expect of our people. So there's a lot of education that goes along with that.
Mm-hmm.
We have charge nurse classes. So if I have charge nurses that need to go to a charge nurse class, they're taught how to coach, basically. Other employees can go to those kinds of things too. But yeah, we do a lot of education.
What's the major thing that you struggle with as a leader of this many people?
Well, evaluation time is very difficult. We do evaluations twice a year. And so we have a mid-year evaluation, and then we have a year-end evaluation. Sorry about that. I should have turned that off.
Oh, you're fine.
But at our mid-year evaluation, I have 3 clinical supervisors, and we'll kind of split up the employees. So I'll get a fourth of them, and then they take the other 75%, and they divvy them up. But then for the year-end evaluation, I meet with every single person.
Oh, wow.
So in January, that's pretty much all I do, is I write evaluations and I give evaluations. That is probably the most difficult thing, is because my feeling is that every person deserves to have a one-on-one meeting with their manager at their yearly evaluation. So that's a commitment I've made to my staff. But it makes for some very, very long hours and a very, very long month. The other thing that's really difficult is the highs and lows of the census. We may have, 10 patients and be low census and be sending people home. And then 3 days later, we may have a really high census and I'm needing extra people. So that can be very challenging, just trying to manage that, because both ends of the spectrum are dissatisfiers. If we could stay in the nice middle,
right.
That would be the best place to be, but we're not there all the time. So it is kind of hard when you have to tell people they have to go home or use their vacation time when they're really not wanting a vacation day, or we're constantly calling, begging people to come in to help. That's very difficult.
Yeah. In the sense of those challenges and stuff, is there anything that you found that really helps to work through them, especially with that one with the highs and lows? is there anything that you find helps motivate like the people to come in when they aren't scheduled or to leave when they're not needed?
That's a tough one because it's hard to know what motivates 120
Right.
people.
Right.
Obviously, there are times when we offer bonus pay when our census is extremely high, so they can get a little extra money. But to constantly be calling people on their day off can be very dissatisfying. So we have a couple of strategies that we use in this hospital. We have what's called a flex pool. So we have a group of nurses who basically can go anywhere in the hospital, but I have my own group of flex nurses who only go into my areas because we're so specialized in maternal health, labor and delivery, and the intensive care nursery. So those are the people we call first, and those are the people that we try to rely on in those times of high census. But what we'll also do is when we put out a schedule, if we know that this day is a little short-staffed, then we send out those days to those flex nurses, and they can pre-schedule into those shifts. So that's one of the strategies that we use to try to get our numbers up in case we need extra people. We also have a paid-on-call system where all of the nurses sign up for 18 hours and a 6-week schedule, and they're basically kind of sitting out there for that shift. And if we're busy or if we get a call in, then we can call them in. They get paid at time and a half, so there is a monetary reward for them, kind of hanging out there on call. But those are some of the strategies that we use to try to get those shifts filled so that we're not constantly calling our staff.
Right.
What do you look for when you're hiring somebody new?
The first thing that I tell people when I'm interviewing them is I don't hire for skill, I hire for attitude. About a year and a half ago, I had hired about 3 nurses in maternal health, and all 3 of those nurses did not succeed in their 90 days, which is unusual, for that many. And I kept thinking, what am I not getting out of interviews that I need to be getting so that we don't have that kind of turnover in the first 90 days. So I reached out to our HR partners, and one of the HR people said, maybe you should try reading this book, and it's called Hiring for Attitude. And in that book, they kind of give you a strategy of how to interview so that you can kind of get into the personality of the person rather than how's your IB skills?
Right.
How are your assessment skills? Those kinds of questions are, where do you see yourself in 5 years? Those don't tell me anything about that person. So I read the book, and I totally came up with a template that I use for every single interview that I do. And it's basically behavioral interviewing, but kind of with a twist. Because a lot of times with behavioral questions, you kind of lead a person into the answer that they think you want to hear. Like, tell me about a problem that you had at your last job and how did you solve it? Well, right there, I've told them, I want you to tell me an example where you solved the problem. Yeah. If you stop and say, tell me about a problem in your current position, you'll be surprised what people will tell you. And so I started doing that about a year and a half ago. And I have just gotten some awesome people. What I look for are positive attitudes. If I hire somebody who is the best labor and delivery nurse ever, but they have the worst attitude, they're going to bring my entire team down. Yeah. So that's what I do. I look for attitude, and I don't hire for skill.
Okay. And you said do you have a 90-day trial period, or what was that first 90 days?
It's a 90-day probationary period.
Okay.
So the person comes in, they go through their orientation, and then that's kind of our time to evaluate, are they right for our team, and for them as well. At the end of that 90 days, then I decide, am I going to keep them, or are we going to set them free? Most of the time I keep the employee, and usually within the first 30 days, you can tell if somebody's going to work out or not.
Right. Yeah.
So,
what words of wisdom would you have for us who are just about to graduate and looking for jobs and entering the career field?
That's a good question. One thing that I see that is happening a lot right now is graduates are coming out of their programs and they're going right back into school. And I know sometimes the schools and the instructors kind of encourage that. Um, but I would say get out of nursing school, get your feet wet with nursing, really get to a point where you really understand bedside nursing before you then jump into the DNP programs or the master's programs, because I think it is so important to know what the bedside nurse goes through, even as you know, move up in your career, or if you decide to go into management, or if you go the practitioner route. I think it's really important to understand what that bedside nurse goes through on a daily basis, to be able to be effective as either position. So that would be my recommendation, is to kind of get your feet wet before you keep on going.
Okay. How did you get to where you are today in your leadership position?
It kind of fell in my lap. This is not something I ever thought that I would do. I started my career off as an intensive care nursery nurse. I worked for 15 years actually 17 years. My husband and I moved here from St. Louis. We are from here, but had moved to St. Louis, lived there for 11 years. I worked as a bedside NICU nurse in St. Louis. When we moved here, about a year after I started as a staff nurse here in the NICU, a position came open as an outcomes coordinator, which is kind of a person who oversees all the babies, makes sure that they get into programs, evaluates products and equipment, writes protocols, procedures. Well, that position came open, and I had somebody come to me and say, "We think you'd be really good at that. Would you consider interviewing for it?" I thought, well, okay. I never thought I'd ever do anything like that, but I thought, all right, I'll give it a shot. So I got that position, and I worked in that position for probably 8 years. And then the manager position came open in the NICU. And again, the director came to me and said, "I really want you to apply for this." And I'm like, okay, I really did not ever think I'd be in management, but I went ahead and did it and got the position in the NICU. And then it kind of even took a stranger turn when the manager of labor and delivery postpartum was reassigned to a different unit in the hospital, and they asked me to take over the whole department. So once again, I thought, well, okay, I'll give it a shot. We'll see what happens. So that's kind of how I ended up with the entire department. So
cool.
It just kind of fell in my lap.
What's your favorite thing about your job right now?
I think probably just having a broader knowledge. You know, when I worked as a staff nurse in the NICU, that was pretty much my focus. You know, I came in, I did my job, I went home, and when I left work at work. But when I became a manager, you know, it kind of forces you outside of your comfort zone. Probably back then I never would have done something like this. I never would have done any kind of presentations, and now I do that all the time. You know, just being involved in committees and groups, and you know, working on outcomes are things that I probably never would have done as a staff nurse. If I had, it would have been very limited. So I think my favorite part of this job is every day is different. No day is the same. I'm doing something different every single day. Whereas when you're a staff nurse, or when I was a staff nurse in the NICU, you know, you pretty much had your assignment, and you knew at 12 o'clock I had these babies to feed, and at 1 o'clock I had meds to give, and then at 7 o'clock I gave a report, and then I went home. With this job, it's never boring. There's always something different to do, and I feel like I affect change. I think I have the respect of my employees. They know that I've got their back. If they need something from me, they know they can come to me for it. So I think just getting to know, you know, more people, kind of learning the rest of the hospital, you know, how does lab work, how does admissions work. I mean, I've had to become a financial person. I've had to learn how to read financial reports and be responsible for budget. So I think it just really took me outside of a comfort zone that I never thought I would go outside of.
Cool.
What are some things that, like, as you were moving up from a staff nurse into all the different positions, that you really, like, had to work on personally, like, your personal skills to succeed in that position?
That's running through my head.
Well, I did a lot of classes. Again, the one thing that BJC is really good at is they provide their leaders with a lot of leadership type classes. So I've done all kinds of leadership classes on just how to discipline people, how when I first started, the very first time I had to bring somebody in and talk to them about a performance issue, I was so nervous I could hardly talk to the person. But as you do it more and as you get more comfortable doing that kind of thing, it just becomes like second nature. It used to be I couldn't sleep the night before I had to do something like that. And now maybe I should be ashamed to say it, but I sleep fine. Because I had to realize that, a lot of times the stuff that I had to talk to people about, they did it to themselves. I didn't do it to them. But so that's one thing, is I really had to educate myself and really just force myself to practice. And that's what a lot of those classes do. We have a class called Crucial Conversations, and that's kind of what it's about, is how do you sit down and talk to somebody, be respectful of them, make sure that you're making them as comfortable as possible, but you're getting your point across. And in those classes, you do a lot of role playing. You do a lot of practicing. So I think that's probably the biggest thing. For me, the biggest challenge was I'm very much an introvert. So having to now get up in front of, 200 leaders in this hospital, every quarter we do like a big management leadership day. And there are times when we have to get up and talk to those people. I couldn't have done that 10 years ago. There's no way I would have gotten up in front of 200 people who were leaders in an institution and talked to them about something that I've done in my department, a quality outcome or something. And now I do it without any problem. But again, it takes just a lot of practice and putting yourself out there.
Besides the classes that you've taken, what, advice would you give about being a leader and earning their respect as well as their trust, and not being like an authoritative leader?
I think the biggest thing is listening. You have to, when somebody comes in and sits down and they want to talk to you about something and they're passionate about it, and you may feel totally different. You may think this person is way off the wall, but you've got to hold back, let them say their piece. You've got to listen, and then give your opinion or whatever. But trust is a two-way street. I think my employees trust me and I trust them. But it's all about the communication. It's being responsive. One thing about the leader before me, they said a lot of times that she would not answer emails or respond to voicemails. And so when I took the role, that was one thing that I took to heart and thought, okay, if that was something that was missing, that they really needed, I need to make sure that I respond. And so even if I get an email from a person that says, hey, I have a question about this benefit, what I will do if I don't know is I will immediately respond to them and say, I don't know, but I'm going to talk to HR. I'll get back with you in a couple of days. If that couple of days comes and HR hasn't figured it out for me, I then email them again. Hey, I'm still waiting to hear from HR. You can't leave people hanging out there, because when you do that, they think you're not doing anything at all about their issue. So that's just one thing that I have done the 10 years that I've been in management, is I make sure that I always respond to my employees when they have questions, and do it in a timely fashion. You can't do it a week later because you've already lost them.
Exactly.
Yeah. You mentioned earlier when you were talking about transitioning, like from a staff nurse into the management positions, how when you were a staff nurse you would just leave work at work. Have you found that you don't do that anymore, or is it just kind of like a different kind of leaving work at work?
Well, unfortunately, I found I don't do that anymore. This is a position where you're basically on call 24/7. So, I get calls in the middle of the night if there's something big going on. I get called on the weekend from administration if there's something going on the weekend and we're short-staffed. And they need somebody to come in, I'll get called in. So, that's always kind of in the back of my mind when we're super busy. Usually that's when the calls come, or when we're really, really busy. So, it is hard to have downtime when you're always thinking that phone call that is happening is somebody from work.
Yeah.
But you just deal with it. The way I try to look at it is, about a month and a half ago, we had a really, really, really busy month, and I was in here for 3 weekends in a row.
Oh, wow.
But that was only 3 weekends out of 52. So that's how I have to make myself look at it, is that it's a snapshot in time. It's a small part of my year were those 3 weekends.
Right.
I mean, it wasn't that great to have to come in here on my weekends off,
Yeah.
but if I look at it as it's not something that happens all the time, and it's going to be a rare occasion, and they truly did need to see me. It was not good in here those 3 weekends. So, I think the staff appreciate, even though I came in and I can't take a labor because I'm not a labor nurse, and I don't know their documentation, because that's the one thing about being a manager, is now that everything is on the computer, I never get into those kinds of programs, so I don't know how to document assessments and vital signs. I couldn't even tell you where to go. I could probably find it, but it would take me forever. And they know that. They know that I'm a nurse, but they know that I can't come in and take a patient assignment for them. But just coming in and saying, what can I do for you? Can I get you a glass of water? Do you want me to answer that call light for you? I think that it kind of brings the level of crisis down just a little bit, if they know that their manager knows what they're going through.
Yeah, just kind of like a sense of stability and all of the
And that, like, you're
madness.
there for them. And
Yeah.
Do you have any more questions?
I mean, I don't. I mean, I guess, is there anything else
Yeah,
you
any other
thought of that you want to tell us?
Thoughts about it?
No, you guys, you had some good questions there. No, nothing that I can think of.
Okay. Well,
Okay.
thank you.
Yeah,
again
thank
for
you
so
letting us
much.
come
You're
in.
welcome. No problem.
Yeah.